Good afternoon. It is Thursday the 25th of February. Welcome to my latest video update. And really there's quite a lot to talk about this week because I'm sure you will all know that this last Monday Boris Johnson, Prime Minister, announced a roadmap out of lockdown for the country which goes right the way through to the 21st of June. And of course that has implications, positive implications for us here at the hospital. But actually the first thing I want to say is that the only reason that we are looking at being able to unlock nationally is because of the success of the vaccination programme. The vaccination programme nationally, I'm sure you will already read, has been rolled out very quickly. And of course here is no exception. We've been able to vaccinate most of our patients and over 80% of our staff. But we do still have staff who remain unvaccinated. And in this video, to any member of staff who hasn't yet been vaccinated, really repeat a message I made before. I really implore you to get vaccinated. There was an announcement by the General Medical Council this week that said for doctors it's their professional responsibility to do so. And I would widen that really to all our staff. It is our professional responsibility to get vaccinated in order to protect each other, our families and our patients. So please, if you haven't yet been vaccinated, please contact Caleb Lloyd, who will be able to arrange a vaccination appointment for you. Now, we're actually reaching a point where those who had their first vaccinations in December are about to receive their second jabs over the next 2 or 3 weeks. And of course, that's great news and really important and will increase the degree of protection for all of those who are vaccinated. As far as the hospital is concerned, we haven't had any new patient infections in the last 2 weeks. And in fact, we only have 2 or 3 patients who are in step down, which means they were infected between 15 and 28 days ago. Now, when we reach the point where we are 28 days infection-free, that is the point at which the hospital will be able to start unlocking. At the moment, the hospital remains in full lockdown because we haven't yet gone 28 days clear. If we have no further infection, we would hit that point on the 6th of March. But obviously that depends upon us remaining infection-free between now and then. So that's the soonest point at which we can start unlocking the hospital. And when we reach that point, hopefully it will be the 6th of March, but it could be later, then we will do so gradually. One of the things we'll certainly be looking to do as the hospital is unlocked is to reintroduce family visiting to patients and residents. Now, in order to do that, firstly, the hospital needs to be unlocked, but we also think it's very sensible to restart family visiting after patients have had their second jab. And at the moment, we're expecting patients to have their second jab on or around the 18th of March. So we are therefore putting together a visiting plan that at the moment would restart on the 22nd of March. That's the earliest date for a restart because, of course, if there were to be further infection between now and then the date would have to change. But at the moment, we are targeting the 22nd of March. Compared with previous family visiting before Christmas, it will be done, at least initially, on a sort of booked and controlled basis. But unlike last time, we are able to provide rapid flow, lateral flow tests, which we'll be asking visitors to carry out before they come into the hospital. It gives a result in about 15 minutes. But that means in those visits, they will be able to be contact in terms of holding of hands. And we do know from the feedback we've had how important that is as the visitors. So hopefully that's seen as a positive step forward. Of course, we all have to do this one step at a time, a bit like the government. What we don't want to do is to unlock too quickly and then have fresh infection. Protecting the patients, the residents, and indeed our staff remains absolutely vital. But we do have a plan. Clearly, there's a few weeks between now and when visiting will restart, so no doubt I will be sharing more detail both via these videos in the written communication over the next 2 or 3 weeks. But that's what we're working towards at the moment. That's all I have to say today, and I look forward to giving you another update next week. Thanks very much.